Well, with this week's Cardiology Countdown, we'll talk about looking ahead at the benefits of weight loss, or questions therein, and also look at some statistics as well as the STEMI guidelines just released. So to begin with, we'll have another report from the Look Ahead trial that was a randomized study of intensive lifestyle intervention in patients with obesity with a goal of trying to reduce cardiovascular events. And this paper looked at the reduction in or resolution of diabetes. They found with intensive lifestyle intervention that involved group sessions and exercise programs very intensively several times a week for the first year and lots of follow-up sessions, as compared with just 3 information sessions a year, the patients did lose more weight. It was 7.9% and 4% at 4 years relative between those two groups. But interestingly, resolution or improvement of diabetes was very rare. So in the intensive group, it was 11% at year 1, but then faded to 7% at year 4, compared with about 2% for those in the standard group. And so while one would hope you could lose weight and resolve diabetes, it looks like that's unfortunately a very rare event. Next up are the AHA Heart and Stroke facts. This is an annual review of the statistics done to give the prevalence of cardiovascular disease, and I think some very interesting numbers. For diabetes, we know the number is growing. It's now just about 20 million Americans have been diagnosed with diabetes, and 78 million with hypertension. Then for hypercholesterolemia, it's hard to know where to draw the cut point. At total cholesterol above 240, they have 32 million patients, and of course many more if you have a different threshold. Interestingly, calorie consumption has gone up in both men and women over the last several years, and exercise has gone down. Really unfortunate trends that may underlie some of these adverse risk factors. And then looking at cigarette smoking, not much change. About 20% of people were smokers, but interestingly, secondhand smoke measured by serum cotinine was pretty markedly reduced over the last 5 years, going from 50% down to 40% overall. So some encouragement on some of the risk factors, but clearly lots of room to go. And then the number 1 pick this week are the new ST elevation guidelines. This is the 2013 guideline. A new full guideline is released and has a great new format with color-coded tables that you can quickly see all of the recommendations. Some of the highlights, I think, pick off of what has been there before, of the desire to have regional STEMI programs. A goal of less than 90 minutes for door-to-balloon time, but noting that it's really 120 minutes as a system goal if you have to transfer a patient. And if it looks like it's longer than that, longer than 120 minutes, that's when one would switch to using fibrinolytic therapy at the outside hospital. An addition of the new P2Y12 inhibitors to the guidelines, so prasugrel and ticagrelor with loading dose and daily dosing, recommended for at least a year, as is standard across the other indications. And then recommendation for high-intensity statin that should be started early and continued, and referral to cardiac rehab. So a terrific new guideline with a great, easily accessible format. I think we have slide sets and quick summary on CardioSource, and so hopefully useful in updating our management for STEMI. So for this week's Cardiology Countdown, I'm Chris Cannon.